Welcome to the deep dive. Life, well, it can throw some incredibly tough challenges our way, as we all know, and today we're diving deep into one of the most immediate, kind of visceral experiences someone might face during serious illness and treatment, nausea. Specifically, we're focusing on chemotherapy-induced nausea and vomiting. CINV is the shorthand. We've got some really powerful source material for you today. These are critical excerpts from Taming Nausea, a caregiver's guide to comfort and care, and it's written by a seasoned geriatric oncologist. So our mission today, it's really to pull out those practical drug-free tips that you as a caregiver can use, like right now, to help your loved ones navigate these rough waters of CINV. We're talking about improving their quality of life and, just as importantly, knowing when it's time to get medical help involved. Okay, let's unpack this challenge of CINV and the really pivotal role of the caregiver. They're almost like a quiet hero in this, aren't they?
They really are. And it's striking how our source immediately sets up the caregiver, not just as, a passive supporter, but as a critical, active participant in this whole battle for comfort. Because while the medical treatments are, of course, absolutely vital to day-to-day reality, those really crucial conversations about someone's quality of life, they often revolve around how well they're managing symptoms like these. And as the source points out, nausea is, well, it's a formidable foe. It completely saps strength, it steals appetite. It can turn the very act of eating, which should be nourishing and comforting, into something that causes real anxiety.
That's a powerful way to put it, eating turning into anxiety.
Exactly. Now, thankfully, we do have a pretty impressive arsenal of anti-nausea medications these days. Antiemetics, they're called. They're really the foundation of treatment. But here's the thing, they aren't always a perfect shield. They don't always work 100%, especially, for older adults. They might process drugs differently, or they might already be taking multiple medications for other things. So breakthrough nausea, it's actually pretty common in that group.
Ah, okay, so the meds are there, but sometimes nausea just pushes through anyway.
Precisely, and that's exactly where you, the caregiver, step in. The source describes the caregiver almost like a detective, a nutritionist, a comforter, and even a first responder, all rolled into one. Your proactive, gentle interventions can genuinely make the difference. The difference between a day filled with misery and, well, a day of more manageable discomfort for your loved one.
That really elevates the caregiver's role, doesn't it? It's not about replacing medication, but working with it, complementing it.
Absolutely, it's a partnership.
So speaking of being proactive, our source talks about this idea of a preemptive strike. I find that really intriguing, this idea of not just waiting for nausea to hit, but trying to get ahead of it. How crucial is that, preparing the body and mind in the hours leading up to, and maybe even during the chemo infusion itself?
Oh, it's incredibly crucial, and honestly, often overlooked. The source really emphasizes that the most effective way to fight nausea is to get ahead of it, sometimes by a full day even. That 24-hour window before treatment, and yes, even during the infusion itself, that's prime time for preparation.
First up, the source is crystal clear. Hydration is non-negotiable.
Okay, hydration, that seems basic, but why non-negotiable?
Well, it's interesting because many caregivers might instinctively cut back on fluids if someone feels nauseous, right? They worry it'll just come back up. But our expert source actually reveals this is often counterproductive. Dehydration itself fuels this sort of vicious cycle of nausea. It makes it harder to tolerate anything later on. So the recommendation is consistent sipping.
Sipping, not gulping.
Exactly. Sipping clear fluids throughout that entire 24 hours before the chemo appointment. Think, water, clear broths, maybe some diluted juices, electrolyte drinks. It's like you're preloading the system for comfort, making it more resilient.
Okay, that makes a lot of sense. Preload with fluids? What about food before treatment? Right, the pre-treatment meal. It's a delicate balance, this one. Because an empty stomach can trigger nausea, but so can an overly full one. So the advice is usually a small, light snack, something low in fat and fiber, about 1 to 2 hours before you actually leave for the infusion center.
Okay, light snack, like what sort of things?
Good choices would be, say, toast with a little bit of jam, plain crackers, maybe a small bowl of oatmeal or cream of wheat, or even just some plain yogurt. What you definitely want to avoid are those greasy, fried, or really spicy foods, heavy sauces, large meals, anything that takes a long time to digest, because that can sit uncomfortably in the stomach and maybe increase the risk of reflux or just indigestion, which you don't want going into chemo.
Got it. Keep it simple, keep it light. Now, what about during the infusion? People are sitting there for a while.
Yes, and that infusion suite environment itself can sometimes be a source of anxiety, can't it? And we know anxiety can definitely heighten the sensation of nausea. You're sitting there, maybe hearing the quiet hum of machines, worrying. That's where these simple distractions become, like your secret weapon.
Distractions, okay. Like what?
Well, first, pack some smart snacks. Again, keep them bland, easy to digest. Saltines, pretzels, maybe some plain biscuits, just something to nibble on if needed. And another thing, surprisingly powerful, is what the source calls the power of sucking.
The power of sucking, okay.
Sucking on something can actually help suppress the gag reflex, and it distracts from any unpleasant taste that might linger. So, hard candies are great, especially sour flavors like lemon drops or mints. Peppermint's good. Ginger candies too, obviously.
Here keeps coming up. We'll circle back to that a bit.
Oh, absolutely. And finally, during the infusion, engage the brain. Distraction is such a potent tool against nausea. Suggest bringing a tablet, with headphones for music, podcasts, maybe a favorite movie, or even just a good book or a crossword puzzle. Anything that shifts the focus away from the physical sensations. Ultimately, all of this, it's about empowering your loved one, isn't it? Giving them back a sense of control and comfort right from the very start.
That's a fantastic way to frame it. Empowering through these simple, thoughtful actions. Okay, so that covers before chemo and during. But what about the days after? That's often when nausea really peaks, right? What are the key dietary strategies for those crucial, say, 24 to 72 hours post-chemo?
Yes, this period is absolutely critical. And this is where your role, the caregiver's role in the kitchen, becomes really paramount. Our source recommends moving away from the traditional idea of 3 large meals a day. Instead, embrace what they call the 6-meal-a-day plan.
6 small meals.
Exactly. Small, snack-sized meals, maybe every 2 to 3 hours. The goal here is to keep the stomach from ever getting too empty or too full. Both states can be triggers. This approach keeps the digestive system working, but gently, without overwhelming it.
Okay, frequent small meals. And what kind of food should be in those meals?
Well, the advice is pretty clear here. Embrace the bland and the beige. This is definitely not the time for big culinary adventures or strong flavors. You want to focus on foods that are really gentle on the stomach. The classic BRAT diet is often mentioned as a good starting point.
BRAT. That's bananas, rice.
Bananas, plain white rice, applesauce, and plain toast. Yes,
Yeah.
It's a classic for a reason, very easy to digest, but you can definitely expand on that. I think plain pasta, maybe boiled or baked potatoes, but without the skin, chicken or vegetable broth, gelatin, or plain crackers.
So really basic, easy stuff. But I wonder, for someone used to lots of flavor, that sounds, well, boring. Does the source talk about managing the sort of psychological side of blandness?
That's a fair point. The source doesn't explicitly offer, mental hacks for dealing with bland food, but the implication, I think, is about framing it correctly, understanding it's a temporary healing strategy, it's a gentle reset for the body. Sometimes just knowing why you're eating this way makes it more tolerable, It's medicine, in a way.
Right, reframing it as a tool for comfort, not a punishment.
Exactly. Another key insight from the source is temperature is your ally. Hot foods often release strong aromas, right? And those smells can be major triggers for nausea when someone's feeling sensitive.
Ah, so cooler foods might be better.
Frequently, yes. Cold or room temperature foods are often better tolerated. So think about offering maybe a cold chicken sandwich, but on plain white bread. Cottage cheese, yogurt, sherbet, maybe a fruit smoothie. Chilled melon can be particularly soothing too, very refreshing.
Okay, temperature matters. And you mentioned ginger earlier.
Yes. The ginger miracle, as the source calls it. And what's really fascinating about ginger is how it seems to work. It's not just settling the stomach locally. It also seems to impact serotonin receptors in the gut, a bit like how some anti-nausea drugs work. So it's not just some old folk remedy. There's some real science suggesting how it helps, which I think can empower you to use it more confidently.
That is interesting. So it's working on multiple levels. How should people take it?
Several ways. You can brew a simple cup of ginger tea, either from a tea bag or using fresh grated ginger. Look for real ginger ale. Check the ingredients, make sure it lists actual ginger, not just flavoring. Or you can offer crystallized or candied ginger. Those are quite potent and very portable. So the challenge for you, the caregiver, is really thinking, how can I leverage these simple, gentle food strategies? How can I turn my kitchen into a real healing space?
That's a great challenge, and it really highlights how many everyday things we can actually adjust. Now, moving beyond what goes into the body, the environment itself, that plays a huge role in comfort too, doesn't it? How can we turn a living space into what the source calls a sensory retreat?
Absolutely. Nausea isn't just a stomach thing, it's a full-body sensory experience. Our source has a whole section on controlling the environment, and it starts with basically declaring war on odors.
War on odors, I like that.
Yeah. Because during chemotherapy, the sense of smell can become extraordinarily sensitive. An aroma that's normally pleasant or just neutral can suddenly become really sickening. So caregivers should try to avoid cooking really strong-smelling foods. Things like fish, broccoli, garlic, onions.
Yeah.
You know the ones?
Oh, yeah. Those smells linger.
They do. And imagine that sudden, overwhelming wave of smell hitting someone who already feels queasy. It can be profound. So this is a perfect time to accept those offers of meals from friends and neighbors. Or maybe use a microwave or a slow cooker, which tend to contain odors a bit better than stovetop cooking.
Good tip. What else on the odor front?
Well, related to that is go fragrance-free. Ask family members gently to avoid wearing perfumes or heavily scented lotions when they're around. Maybe switch to unscented laundry detergents and soaps for a while. And don't underestimate the simple power of fresh air. Whenever possible, crack open a window, get the air circulating, help dissipate any lingering smells.
It sounds like such small things, doesn't it? Changing the smell of a room. But I can imagine how huge that could feel if you're battling nausea, like creating a sanctuary.
That's exactly it, creating a sanctuary. And in Beyond Odors, the source emphasizes harnessing the mind-body connection.
Yeah.
Acupressure gets a specific mention, particularly the P6 point, or Naguan point.
P6, where's that exactly?
It's on the inner arm. Go about 3 finger widths down from the crease of your wrist. It's right there between the 2 main tendons. Think kind of where you might feel your pulse, but just a bit further up the arm towards the elbow.
Okay, inner wrist, 3 fingers down between the tendons. And what do you do?
Just apply firm, steady pressure there. You can use your thumb. That pressure can actually help relieve nausea for many people. You can also find simple, elasticated acupressure wristbands at most pharmacies, like C-bands.
Oh yeah, I've seen those. For travel sickness.
Exactly. Same principle. They're drug-free, no side effects, and surprisingly effective for a lot of people dealing with chemo-induced nausea too.
Yeah.
It reminds me of a story I heard about a caregiver who made this little comfort kit for the infusion center.
Oh yeah.
Yeah, it had like a special soft blanket, a specific type of sour candy the patient liked, and a playlist of calming ocean sounds. Our source really validates that kind of thoughtful approach, doesn't it? These little comforts matter.
Absolutely. Creating that little bubble of comfort. What else for the mind-body connection?
Another really powerful, accessible technique is simply to breathe through it. When a wave of nausea hits, you can gently guide your loved one through slow, deep breathing. Just inhale slowly through the nose, hold it for maybe 3 counts, and then exhale slowly through the mouth. This simple act can really help calm the nervous system and just lessen the intensity of that nausea feeling. It's amazing how these seemingly small environmental tweaks and these mind-body techniques can significantly empower someone, transforming a really difficult experience into something maybe a bit more manageable.
It really is incredible how much power these non-drug interventions hold. It gives back a sense of agency, I think. But as caregivers, we're also the vigilant observers, right? We're on the front lines. And while all these practical tips are fantastic, incredibly powerful for mild or moderate nausea, there are definitely times when things need to escalate. So what are those critical red flags, the signs that tell us, okay, time to call the doctor or the oncology nurse?
You've absolutely hit on a crucial point there. That role as a vigilant observer is key. And knowing when professional medical help is needed is paramount. Our source is very clear, very specific about the signs that require immediate contact with the oncology team.
Okay, what should people be looking for?
First, uncontrolled vomiting. And they define that as vomiting 3 or more times within an hour, or maybe more than 4 to 5 times over a full 24-hour period.
Okay, 3 times in an hour or 4 to 5 times in a day. Got it.
Second, if your loved one is unable to keep anything down. And the really critical part here is liquids. If they cannot keep any liquids down for more than 24 hours, that is a major, major concern for dehydration. That needs attention quickly.
Right. Liquids are key. What are the signs of dehydration we should watch for?
Good question. Be alert for things like dizziness or feeling lightheaded, especially when they try to stand up. Check their urine color. If it's dark, think the color of apple juice or even darker, that's a sign. Or if they simply haven't urinated for over 8 hours, that's another big warning sign.
Okay, dizziness, dark urine, not going for 8 hours, anything else?
Yes, one more category is extreme weakness or any change in mental status. So if they seem unusually drowsy or disoriented, confused, maybe difficult to wake up, that absolutely warrants a call to the medical team right away.
Okay, so uncontrolled vomiting, can't keep liquids down, signs of dehydration or extreme weakness, confusion.
Exactly. And the source really stresses this point. Please never hesitate to make that call. Don't wait. The oncology team has many different types of anti-nausea medications they can try. They can adjust the plan. They expect these calls. Your loved one absolutely does not need to just tough it out. That's not helpful or safe.
That's such an important message. Don't tough it out. Call for help.
Absolutely. Uncontrolled nausea is a medical issue. It needs to be addressed properly by the medical team. This whole section really underscores that blend, doesn't it? The blend of proactive, gentle care from the caregiver combined with informed vigilance. Knowing when to act and when to escalate. That's what makes the caregiver role so essential, so life-affirming, really.
That guidance is so vital. It really empowers caregivers to act confidently, knowing those boundaries. Wow, what an incredible deep dive this has been into taming nausea. Ooh, it's just so clear that the power of these proactive, gentle interventions by caregivers, well, it really can't be overstated, can it? These drug-free strategies, as we've discussed, they work right alongside the prescribed medications. They offer this vital layer of comfort, of control for people navigating the really tough challenges of chemotherapy. Thank you so much for joining us on the deep dive today.
Yeah, and just to leave you with a final thought, building on the source, by being prepared, by being observant, and by being gentle, you, the caregiver, you provide this layer of comfort and control in a situation that can feel completely overwhelming. Your steady presence and these practical actions we've talked about, they are genuinely a powerful therapy in their own right. They help your loved one navigate these really rough seas of treatment with more dignity, more strength. So maybe for you, the caregiver listening, just consider how deeply impactful your thoughtful, attentive presence truly is. It's not just support. It's actually a vital part of the healing process itself. Your commitment really transforms these difficult moments into shared acts of resilience.